Hi everyone. This is going to be the first video on ethics that I am posting. It is about the common ethical violations that you can find in a therapeutic practice. And to start off, I'm going to talk about a case here in Georgia that happened. And I tell you, the things that people have done in the past are amazing. And it's kind of scary that something that you are trying to prevent can actually be the thing that will get you in trouble. So the case in discussion is Bradley Center versus Wessner from 1982. And in this case, you have an enraged patient that has very hostile tendencies. This patient who's in an inpatient facility for mental health has told his therapist that they have intent to harm a particular person. They have pointed out this person and said that I'm going to kill this person. And in order to make sure that they are trying to not break any laws, they forgot about the duty to protect. So what happened in this case is that the Georgia Supreme Court affirmed the decision that the potentially violent inpatient was not controlled after a clear threat was made to the intended victim that he had identified previously. So the decision by the Georgia Supreme Court identified that there was a legal duty for the case of the doctor to show that the patient was well enough. You know, the doctor needs to know their patients. And with the doctor knowing the patients, he didn't make sure that they kept this violent person away from the other identified victim. So in the inpatient facility, you're supposed to have more controls. Just imagine if this was out in the community at a regular doctor's office, a therapist's office, or in-home counseling session, and this violent person has informed you that they're going to hurt somebody. What do? It's a whole different level of helping people and precautions that you have to take. So they did not find that there was a duty to warn, but a duty to protect. So the Supreme Court wanted not only for the identified person to be warned about the intent, or the authorities to warn, to let everybody that's surrounding this patient know, hey, that this can potentially happen, but they didn't protect the patient from actually getting harmed. And this patient actually died as a result, as a hospital was at fault. So they did not follow the guidelines for duty to protect code by allowing the dangerous inpatient access and killing that identified inpatient. So as with most of my research and papers, I like to look at certain articles, and one that I use a lot of times is Herman and Herlihy from the 2006 article, and in that they explain that the Code of Ethics was founded on the idea that moral principles were to help professionals stick to the ideas of fairness, beneficence, non-malfeasance, and respect for autonomy. Professionals are to do no harm, which is the beneficence, and protect the welfare of the client first. After the patient was identified safe, then the ripple of protecting others around them is important, such as clients, family, professionals, and the community. So this case was a big deal, and you have to look at all the surrounding outsides of it. And there are so many more ethical violations that people don't think about that are reported. And that's not just in Georgia, but that's everywhere. So other violations could be communication of therapist conflicts with the client, telling the client what the problem is, Transference of emotions, countertransference. You have dual relationships. You are counseling your sister-in-law, or you have a student and you're counseling your student. It's like too many different roles that the person has. Other ones is, it happens. Therapists can sometimes find themselves in a romantic relationship with their clients, and some of them think that they get away with it by saying, well, we're going to end this relationship as therapy so we could pursue each other romantically, even though they're not probably having that direct conversation is happening, and that is a violation. It is being reported, whether it is by colleagues, the client, when they're angry, or the professional themselves. I don't know if they would snitch on themselves, but that happens, and happens a lot. And then you have the transference contamination. So it is really difficult for you to sit in a counseling session and listen to somebody talk, and you're contaminating what they're saying and sometimes giving it back to them. That is something that is not right. You're not supposed to harm them. You're not supposed to trigger them in certain ways without making sure that they're safe and secure in that environment. There are a lot more different ways that you can have ethical violations. It could be with informed consent, in the beginning of the process, informing them the do's and don'ts, the rights, the wrongs. You should inform them of the policies and everything surrounding how services will go. A client foremost needs to know what their rights are. So with that being said, I think this was a great summary of what the violations are in the small level. There are a lot more violations that can take place in this therapeutic relationship. And I really hope that this video helped. And stay tuned for the next set of videos that I will be sending out to make sure that you are up to date on ethics. Thank you.